Hello friends, today I am going to teach about the topic is combined effect of drugs. So how the combination of the drugs, how it will works in our body. So during the combination of the drugs, we have to know about the pharmacokinetics and pharmacodynamics. By the combining effect of the drugs, we learn in the pharmacokinetics, that is absorption, distribution, metabolism and excretion. So that pharmacokinetics are learned in the in vivo method in animals. After that, we have to know the effects in vivo methods in animals, then in vitro, next in vivo method of the human voluntaries. So after that, we can learn about the pharmacodynamics. So in that pharmacodynamics, if it is show 100% accurate effectiveness, then we have to go through the formulation of the drugs. So by the combining of the drugs, it shows its effectiveness. Nothing but it shows the pharmacological action. This is known as combined effect of drugs. So here combined effect of drugs is nothing but when two or more drugs are given simultaneously or quick succession, they exhibit synergism and antagonism. Nothing but if the drugs, two or more drugs are given, means simultaneous means at a time. If two or more drugs are in the combination, they formulated or they coated in one tablet form, so or in one capsule form or in one injections form, the two drugs are in one compound formulations. So at a time, the drug given to the body, patient's body at a time, and they exhibits the either synergism or antagonisms. So here synergism have two types, that is additive synergism and supra-additive synergism, and antagonism has two types, that is competitive antagonism and non-competitive antagonism. So here we learn about the synergism first of all. So here synergism means nothing but synergism is, it is a Greek word, and syn means together, ergon means work. So working together is known as synergism. So the combination of two drugs to give effectiveness. So here synergism is nothing but working together. The combining of the two drugs shows its pharmacological action and shows its the effectiveness to cure the disease or disorders is known as synergisms. So if both the drugs are in same direction, so suppose for example aspirin and paracetamol have the analgesic property and antipyretic property. Here the drugs are in same directions, so one drug is simulated to the another drugs. If the drug having only, if does not shows its action but it stimulate the another drug, is known as synergism. So in synergism we have additive synergism and supra additive synergism. Here additive synergism nothing but the effect of two drugs is in same direction and it adds up. So if the paracetamol have analgesic property and antipyretic property and it is in same directions, so they adds up means they mix up. So they coated the tablets, two tablets in one formulation only. So this is known as additive. So this is the effective of the two drugs is known as additive effect, additive synergism. For example, effect of drugs nothing but A plus B. Here effect of drug A plus B nothing but, for example, we have to take A drug is aspirin and B drug is the paracetamol. So the combination of the both the drugs is shows 100% accuracy. If the without combination, if the individual drugs effect of drug shows, suppose aspirin shows 50% and effect of B drug shows 50%, paracetamol nothing but it shows 50% and it shows 50% individually, but by the combination of the both the drugs it shows 100% activeness and shows the effectiveness to the patient's body. Next here aspirin plus paracetamol gives rise to, so they have the analgesic property and antipyretic property, the both the combination of the drugs, and ephedrine plus theophylline. So ephedrine and theophylline, here ephedrine is a the drug and theophylline is the another drug. So they both the act as a bronchodilators. Nothing but it's used in the asthma. So they dilate the respiratory system. This is the drug, combination of the drug. Next, supra additive drugs. So here supra additive drugs, nothing but supra means more than the additive, that is nothing but supra. So here effect of combination is greater than the individual. So here individual have the 50% of 50%, and both the combination shows 100% accurate results. But here without combination individual, they do not show the pharmacological action. But these super additive means by the combination it shows the greater, means greater activity, greater affinity, so more active. But individual, they does not shows the pharmacological action. This is the difference between the additive and super additive. Here effect of drugs A plus B. For example, effect of drugs, here A drug is nothing but levodopa and B drug is the carbidopa. These are used in the nothing but levodopa and carbidopa we are using in the dopamine inhibitors. So but here the both combination effect of drug A plus effect of drug B shows 50%, but these combinations show 200%. So individually it will shows, or it does not shows, but it does not it does not stimulate the another drug. So by the combination it shows its pharmacological action. This is the super additive formulation. So here levodopa plus carbidopa and benzyrazide, these inhibits the peripheral metabolism. So how the peripheral metabolism inhibits means, so when we are shivering or anything, we have the tremors and triggers the tremors. Levodopa inhibits the levodopa when the body will triggers, means shivers the body. By the combination of levodopa carbidopa, they inhibit the peripheral metabolism, nothing but hands, legs, they stop their shaking. So shaking the hands and legs, they will stop that particular drugs. So in here adrenaline and cocaine, they inhibit the neuronal reuptake. So neuronal reuptake is nothing but the here synaptic vessels were taken. So adrenaline is a hormone, it is also a hormone, and cocaine, it is a highly effective addictive drug. So it is cocaine is an opioid drugs and adrenaline, it is an hormone, and both the combination of the adrenaline, it shows the flight and fight. So response, it stimulates the response, adrenaline and plus cocaine. So cocaine is an opiate drug, so it is a highly addictive drug. So both the combination, it inhibits the neuronal reuptake. So synaptic postsynaptic vessels are inhibited by the neuronal uptake. So this is the combined effect of the drugs of synergism. So next we will learn about the antagonism. Thank you.